Hi guys, Doc Chris here. I wanted to take a moment to introduce you to the Tiger BJJ High Intensity Stretching Program. So a lot of you have had some questions, and I'd like to take a moment to clarify some of the theory behind what makes this approach to flexibility development uniquely effective for the inflexible adult to improve their ranges of motion. What works for kids? Basically passive stretching. It's going to lead to poor results and early plateaus in adults. So first off, you're probably thinking, 1 hour? Seriously? Let me reassure you, this hour will not all be hard stretching. We will start with dynamic work, for example, leg swings, and progress to joint mobility, basically end range joint articulations, and then move on to isometric stretching, which I call the deadlifts of stretching. There will be a limited use of props to assist the less flexible in having a more useful and enjoyable experience. But seriously, my approach, while effortful, is not sadistic. It's scientific, and while being intensely effortful will not injure you if done correctly. The intensity is also going to be matched with moments of intense relaxation. Ask Nelly, he knows. The approach emphasizes manipulation of the nervous system and building connective tissue strength at our end ranges. Alright, now for a little theory. Limitations in flexibility are with few exceptions related to your nervous system, not tight tissues. Allow me to explain. As a doctor, if I give a stiff elderly patient a general anesthetic, if we're not careful, they can flop right into the middle splits. In the operating room, we often have to be very careful positioning particularly elderly patients due to this risk. So, is general anesthesia the secret to developing flexibility? Hells no. Because connective tissues have not been conditioned and are weak and highly prone to injury outside of their normal range of motion. This is why my approach to stretching is an active one that builds end range strength and connective tissue integrity. I'm going to talk a little bit about the nervous system here. We're going to nerd out a tiny bit. But essentially, your nervous system's primary goal is to keep you safe so that you will survive and pass on your genes. If your nervous system were to let you access a range of motion that your soft tissues were not capable of managing, you would experience a muscle, tendon, or ligament injury, which could greatly affect your ability to feed yourself and be fruitful and multiply throughout most of our evolutionary history. So take a moment here. I want you to think of your nervous system like an overprotective mother. You want to go play outside. In our world, that means developing a full range of motion. Let's talk about the butterfly position, for instance. Your mother doesn't think that it's safe for you to play outside. She doesn't allow you to go outside of your current range of motion. So what does she do? She locks the door. In our example, she sets your stretch reflex and range of motion so that you can't get those damn knees to the floor. You need to trick mom and climb out through the bathroom window. What we mean by this in the stretching world is using isometric contractions to trick your nervous system into letting you into a slightly increased range, and in so doing build the strength and integrity of your connective tissues. So what's isometric stretching? I've been talking long enough, and we'll talk about this in class. Suffice to say, it was extensively studied by scientists and Olympic trainers in the former Soviet bloc and was found to be the most effective method to increase flexibility in adult athletes. You don't need to stretch every day to achieve great increases in your current range of motion. A once per week heavy stretching session combined with a few light dynamic stretching and mobility drills throughout the week will bring great fruits. Trust me, I couldn't touch my toes 2 years ago. So, guys, come on out Friday afternoons, 1 p.m. to 2 p.m. to smash past your current range of motion limits, reduce chronic aches and pains, and give yourself greater freedom and movement possibilities. This is Doc Chris saying see you Fridays. First class, October 12th, I believe. And by I believe October 12th is a Friday. Cheers, guys. See you on the mats.